Medication administration via metered dose inhaler, or MDI. A paramedic may administer salbutamol to patients who present with respiratory distress and with signs and symptoms of suspected bronchoconstriction, secondary to COPD, asthma, or anaphylaxis. This medication can be given in conjunction with epinephrine, depending on the presenting severity of the bronchoconstriction. Equipment required for the treatment procedure includes metered dose inhaler, the inhalation mouthpiece or boot, and an aerochamber. Additionally, this medication can be administered using an inline MDI adapter with CPAP or in conjunction with a bag valve mask. Once the patient has been fully assessed and determined to be experiencing bronchoconstriction, consider the most appropriate route of administration. Always validate that it is the correct medication by reading the label name and confirm that it is not expired. The first method shown is using the MDI and the accompanying mouthpiece or boot. Medication droplets dispensed from the MDI using this method are large and are harder to inhale deeply, as much will end up on the buccal lining or at the back of the oropharynx. Allow the patient to exhale and time the administration of the medication with the inhalation phase of the respiratory cycle. The medication is released by depressing the MDI into the boot. One spray is equivalent to 100 micrograms and is given once every 4 breaths. One dose is a total of 6 sprays, or 600 micrograms, for patients less than 25 kilograms, and 8 sprays, or 800 micrograms, for patients that are greater than or equal to 25 kilograms. The second method shown uses an aerochamber to aerate the salbutamol medication into smaller droplets. This creates a smaller, more mist-like droplet that is more readily inhaled deeper into the lungs. Similar to the first method, the delivery of this medication is timed to the patient's inhalation phase in the respiratory cycle. Should the patient respond to coaching, have them force exhale prior to the administration of each spray. This medication may also be given via an oxygen-supported nebulizer. However, this method is contraindicated in patients with respiratory infections such as pneumonia, whereas the MDI method is not. In all cases, personal protective equipment is to be worn while administering aerosol medications.